Nearly 2 years into the pandemic, many countries are once again ramping up COVID restrictions in response to the rapid spread of the Omicron variant. In the U.S., hospitals and health workers are bracing for an expected surge after the holidays. And across the Atlantic, large parts of Europe are reimposing partial lockdowns to curb record numbers of new cases.
Rounding off the year with another variant and another set of measures to fight back. Countries across Europe have tightened restrictions, dampening planned New Year's Eve celebrations as Omicron spreads. France has announced a range of new measures, including reducing the wait for booster jabs to 3 months. The government will also vote on a new bill to bar the unvaccinated from entry to places like restaurants and cinemas.
Today, we have adopted the following additional measures, which will apply from next Monday for a period of 3 weeks. To slow down Omicron, large gatherings will be limited to a maximum of 2,000 people indoors and 5,000 people outdoors.
Across the Channel, cases are soaring as Omicron takes hold as the UK's dominant strain. New restrictions have caused confusion, with Northern Ireland, Scotland and Wales tightening rules, while in England, authorities said they would wait and reassess in the new year.
How are you finding this day one of new restrictions again here in Northern Ireland?
I am slightly bewildered. I don't understand them. I've come over from Scotland, so everything's different.
In the US, Omicron has caused chaos for airlines. With over 200,000 daily infections nationwide, crew shortages have grounded planes. But President Joe Biden said the vaccination drive meant the US was in a better position than in previous waves of infections.
America had made progress. Things are better. But we do know that with the rising cases, we still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff.
On Monday, New York City brought into effect a vaccine mandate for nearly all private sector workers. Proof of vaccination is also needed for most indoor activities, like eating in restaurants. Strict measures that officials hope will keep the city fully open as the world crosses into the 3rd year of the pandemic.
Peter Ching-Hong is an infectious disease physician and a professor of medicine at the University of California. He joins me now from San Francisco. Doctor, COVID cases are on the rise in the U.S., and not surprisingly, hospitals are bracing for a spike after the holidays. New York has even introduced a vaccine mandate for businesses, as we've just seen. Sensible, sufficient moves by authorities?
Well, Michael, the answer is yes and no. It's kind of like putting out a forest fire with just a few buckets of water, but you can't blame the Biden administration. It's caught them by surprise. Many people thought they put all of their eggs in the vaccine basket, so now we're trying to diversify with more testing, PPE, additional labor. It may be good for some parts of the country, like the West Coast, where it's not as bad, but in the East Coast, it may be too little, too late.
U.S. health authorities, as you well know, have eased quarantine recommendations from 10 to 5 days. Is this a further hint that Omicron is a less severe corona variant?
I think that's partially the answer, Michael, but I think the CDC was motivated to do this really because of a variety of factors. One, there was a lot of political pressure because of workforce that was taken out for probably an outdated quarantine 10 days or isolation of 10 days, but it's also a nod to the fact that there's some evidence that the incubation period for Omicron is much shorter, 3 days compared to 4 days for Delta and 5 for Alpha, for example. But many people are worried because, again, the tail end requires that people wear masks for the additional 5 days after 5 days of isolation. They have to have no symptoms, and there's no testing involved. So there's a lot of sort of like you're on the honor system after those initial 5 days.
Right. Here in Europe and around the world, we're seeing countries reintroducing restrictions, including new lockdowns, and reinforcing the imperative basically to social distances. You're a doctor, so all politics aside, is that alone what we should do to minimize, if not eliminate, the spread of this variant?
Well, I think, Michael, again, it's so hard for Europe right now because it's in the middle of the thunderstorm and you're trying to repair the roof. So it's almost all hands on deck. So one thing isn't good enough. Vaccines isn't good enough. Booster uptake hasn't been quite as good as people had hoped. Again, took everyone by surprise. I think testing isn't quite as emphasized in Europe. Rapid testing at home, say as in some parts of the US, and of course, we can't even get testing to buy anymore. They're all sold out. So I think as many things as you do as you can will mitigate the damage that's already in progress. That's
Dr. Peter Chin Hong in San Francisco. Thank you, sir, for your time and your perspective. Here's a roundup now of some more developments in the pandemic. Australia recorded another record surge in cases as an outbreak of the highly infectious Omicron variant disrupts the planned reopening of the economy. Turkey has also seen infections spike. According to the health ministry, new cases rose by 30%. That's the highest percentage rise so far this year. And Indonesia has detected its first locally transmitted Omicron case. The patient had no recent history of overseas travel, was asymptomatic, and now isolating at a Jakarta hospital. Tougher curbs on public life also went into effect in much of Germany today. Several regions have tightened restrictions on public gatherings and access to public events ahead of New Year's Eve. Thousands took to the streets overnight to protest COVID restrictions, mostly in Germany's east. Clashes erupted in a number of cities, with at least 10 police officers reportedly injured. But other people have been flocking to vaccination centers for their booster shots. Germany's government is urging people to get vaccinated as the virus's Omicron variant spreads.
Even during the festive season, thousands of people are getting their jab, like at this vaccination center in Berlin. At the moment, more than 70% of the population is fully vaccinated, and around 36% of all Germans have received a booster shot.
Die Boosterimpfung.
Boosterimpfung, die dritte. Booster. Yep.
Booster.
Right now, we are barely giving any first shots in vaccination centres. Up to 98% are booster jabs. People who come here are already pro-vaccine and have actively sought out a vaccination.
People turning up here for a booster shot believe it's the key to ending the pandemic.
I think it's good. The more people who get vaccinated, the better it is for all of us. That's why it's also very important for me.
It's super important. I think it's very, very important. I'm a bit worried. That's why I'm here. I got it because my job is important to me and I come into contact with a lot of people. The booster and my health are important.
Germany has introduced new social distancing measures and restrictions. Under the so-called 2G rule, only those vaccinated or recently recovered may enter many venues and events. Under the 2G plus rule, people also have to show a negative test result on top of that. Thanks to these measures, Germany has managed to halve the number of infections per 100,000 inhabitants between the end of November and the end of December.
We'll also be here over the new year to vaccinate people because we're in a really critical phase. We're in a situation where every day counts and where it's better to be vaccinated today rather than tomorrow.
Authorities fear a new wave of infections due to the Omicron variant will not only hit the population hard, particularly the unvaccinated, but could also affect the running of critical infrastructure such as hospitals and other public services.